Thanks very much, Chair, and can I thank everyone for their contributions. To Deputy McNamara's points, the Deputy stated that the Oireachtas, that these amendments that we're discussing right now, that these give the Oireachtas the power to scrutinise the regulations, that they give the Oireachtas that power. I fundamentally disagree with that statement. The Oireachtas already has that power. These amendments in this bill don't give the Oireachtas the power to scrutinise things the government does. The Oireachtas has the power to scrutinise anything the government does. And not only that, but the Oireachtas has the power to annul every single regulation that is put before this House, every single regulation that I sign. I signed one about half an hour before we started this debate. The Oireachtas can annul that regulation if it likes. So I think it's very important. I think it's very important that we understand that. I think it's very important that we understand that the Oireachtas absolutely has the power to annul any regulation laid before it.
What did you sign today?
Every single. Chair, I wonder. Chair, I wonder. Chair, I wonder. Deputy McNamara has taken to shouting regularly at people's contributions. Deputy, I have sat here for hours listening very carefully. I'm trying to address all of the points you raised. I wonder, would you just afford me the respect of allowing me to answer your questions? You know, you've stood up here month after month after month and demanded.
Deputy, fact, we cannot scrutinise the regulations.
Please, can you just look? The system here is that the members get an opportunity to speak, and the Minister gets an opportunity to respond. The Minister did not interrupt anybody else, so please don't interrupt the Minister. What's the point of order?
I mean, I'd like to get clarification from the Minister as to how we can scrutinise.
No,
I would. He introduced the topic. He said that we can any time.
Yeah, well,
let's
hear the Minister out, and it may become clearer for you as he goes on. Minister.
Thanks, Chair. So, Deputy, you have demanded that I, on behalf of government, are accountable to this House repeatedly, and I think you're right to demand that. But in order to hold me to account, you've got to let me finish, actually answer you. I'm trying to answer you, okay? So the point I'm making is that the Oireachtas already has the power. Either House, the Seanad or this House, can annul any regulation it wants, any time it wants. But the amendments here go much further. The amendments here don't just make these houses the legislative body, which of course they are. They would also make these houses the regulator, because they would, but it's in the amendments, Deputy, every single regulation proposed would have to be voted on and passed by both houses of this Oireachtas, right? So there's a very important democratic safeguard in place, which is the houses, either house, can annul any regulation. But if we were to move to a position where any regulation that the government wants to pass has to be voted on and passed actively by these houses of the Oireachtas, then we've moved into a completely different place where the legislative body actually becomes the regulator. And I'm just going to speak to that in my contribution later on, why that simply doesn't work. Deputy, with regards to the COVID pass, you were asking directly, is it about vaccine uptake or is it about keeping people safe? The rationale is based on keeping people safe. And the rationale, which obviously any of us are free to disagree with, the rationale is that the COVID pass is being applied to higher risk environments. And there is a very real concern that people going into those higher risk environments who are unvaccinated, there are two risks. The first and most important is that they themselves are at much higher risk of serious illness if they are unvaccinated. Secondly, there is a higher transmission risk as well. So they are the two public health rationales for the COVID pass. And then I think you've asked a very important question. I think various deputies have. What about the group of people, not necessarily who choose not to get vaccinated, but who can't be vaccinated? Because we know there are situations where people can't be vaccinated. I'm very happy to keep this under constant review, and I've spoken with the public health officials on it before. The last time we discussed it, the point that was made to me was a lot of the people who cannot be vaccinated for medical reasons are actually a lot of the time more vulnerable by virtue of having an underlying condition. And by giving an exemption, what we'd actually be doing is saying to a higher risk individual, here's an exemption for you to go into a higher risk environment, right? And there's a real concern, a genuine concern, and we can debate whether it's right or wrong, but the concern is motivated only by keeping those people safe. So that's the rationale at the moment. I think it's something we need to keep under review for the obvious reasons, some of which have been debated here. With respect to permanent immunity, Deputy, no one is suggesting permanent immunity. Nobody. I know I heard you and I understand the modelling. The point in the modelling was they didn't model the waning, the different curve. So the data we now have, as you're aware, is that the different vaccines wane at to different levels and at different speeds. And I haven't seen exactly what you've said, but my guess, having not seen it, is that there was probably a piece of modelling done by the modelling team that said they simply didn't model in any waning. That's not a judgment as to whether or not there is waning. It might simply have been before they had the ability to do that. But nobody, to be clear, nobody is suggesting these vaccines don't wane. We have incontrovertible evidence, I would suggest, that says that they do wane. Hence the boosters. Hence why the boosters are so important. Deputy, specifically to your constituent, can I clarify that swimming pools are not. The COVID pass is not required for swimming pools. It's been exempt, so hopefully some good news. Nor is it required for personal services. Now, I know you weren't suggesting it is, but you referenced haircuts. So, like, my heart breaks for that person, as all of us do. This is an awful situation to be in, but just in that individual case, that's the situation. Deputy Nolan is gone. But she raised a concern, I think a huge concern around the impact of all of this on non-COVID care. And is it having an effect, and is it already leading to more severe illness? I think it is. Will there have been delays in diagnosis? I'd say undoubtedly there have. I think there is a huge issue in terms of the impact that this has had in Ireland and everywhere else in terms of non-COVID care. It's really, really serious. Now, however, where I would disagree with Deputy Nolan, and Deputy McGrath might have been making the same point, is that somehow having these measures in place, are the cause of some of the impact on the non-COVID care. The opposite is the case. One of the benefits of these measures in suppressing the virus is to free up as much of the healthcare system for cancer care and paediatrics and everything else that is required. Deputy Shortall, first, can I acknowledge your support for the bill? I want to acknowledge that, and I hear you say that maybe I'm not that easy to work with. You may not be the easiest to work with at all times either, Deputy, would be my response to that. However, I have genuinely tried to make meaningful moves, but they don't seem to be being acknowledged. So there was a request that the Health Committee and the members would be notified of regulations. I've signed 3 regulations since that, and my understanding is you should have been notified of all 3. And I've written to the department and I've corresponded with the chair of the committee to that effect. So that is something that was requested, right? You asked for an impact report before we come back on mandatory hotel quarantine, and I committed that we would do that, and we discuss it at whatever length the Dáil and the Seanad want. There was a very serious and substantive request for a change to a bill in July, which was to add one sunset clause. That was a request from you, from Deputy Cullinan, from others in this House. It was a matter of substance such that I had to go back to government and get an updated government decision on it, and then we came back. And that's one of the reasons we're here, is because we now have these limited. So there was a very major request in a change to a bill. I listened very carefully. I went back to government. I got a different government decision, and I came back and we amended it. Now, in my 10 years in opposition, I don't remember any of us in opposition at the time succeeding in having major changes like that made. So I know it can be frustrating, but there are genuine efforts being made and substantive changes to bills through the process. And indeed, this bill has been crafted cognizant of that ask from opposition last time. So in this bill, again, there's only one rollover allowed, and that is because of what opposition asked for the last time we were here on it. You have quite rightly asked for more briefings. There was a briefing the week before last, and I'm organising one for this week as well, particularly in the context of Omicron and everything that we're learning about that. So I refute the claim. I don't think it's fair to say that I'm not listening and that I'm not genuinely trying to engage with the Oireachtas and with opposition. I really am, and they are examples. They are examples of changes. Sorry, Deputy.
And antigen testing were the two issues.
Yeah, that's my next point, Deputy. To suggest that I or others are not listening to the science, I think you know when you say that that's simply not true. I mean, it's a good soundbite, but you and I know, and everyone in here knows, that the government's response has been public health led. And when you talk about antigen testing, to suggest that I won't listen to anyone other than NEFIT and then give the example of antigen testing, I set up an expert group led by the Chief Scientific Officer to give me advice other than advice coming from NEFIT. I took that advice and then I set up an implementation group led by Professor Horgan. And that's the reason that a lot of the work on antigen testing happened. So it's simply not true, and I know you know it's not true, to suggest, I'll just finish this sentence and then come back to you.
6 months after you got advice from Mark Ferguson.
I think you know it's not true to suggest that I won't listen to anyone other than NEFIT on ventilation, or sorry, on antigen testing, in fairness. On ventilation, I want to recognise that you have been advocating for this consistently for a very long period of time. It has been looked at several times. There was the group that reported into NEFIT, as you know. NEFIT didn't endorse their view, it noted the view. We have this group in the HSE called AMRIC, which was originally set up for antimicrobial resistance, but which is providing expert advice on this. And I would just point out another group that I think do very excellent work, the SAGE group that advised the UK government. They recently published a paper on ventilation. And on HEPA filters, which is what a lot of the conversation has been around, they didn't conclude that this is something that should, for example, be used in every school. They said it could have a role to play, but that more data and more evidence was required. So, having looked at the evidence, the experts are concluding that it's not as clear-cut. However, I welcome, I've no doubt you welcome, the recent announcements in terms of additional funding in education. Now, to your specific amendment, which is a much less, it's a more not defined. It's a more modest amendment, if you like. It's not about the Oireachtas having to vote through all regulations. On the face of it, it seems like a very reasonable amendment and one I would like to be able to accept. The reason I can't accept it is because of the timing issue. So what I'm trying to do, again, I genuinely am trying to meet you halfway. So we've put in place now, based on the debate we had last week, is very timely updates for all of you in terms of the regulations. And I asked again today for the department not just to send you the regulation, but to send a briefing note on it. And then, of course, the Dáil can schedule its time to debate any of those. The reason I can't accept the amendment specifically is the 48 hours. And it's just the need sometimes to be able to move very, very quickly. So if you think back to last week when we found out about Omicron, there were, so for example, there was a cabinet meeting on Friday. In fact, while we were all here debating this bill, second stage of this bill, there was a cabinet meeting. They made decisions. Obviously, I was here. I didn't attend it. We in the Department of Health needed to regulate and have those regs signed by midnight on Monday, which we did. But if we just think through, it would be reasonable if we're laying things before the Dáil for 48 hours. There would be 48 hours where the Dáil and the Oireachtas are sitting, right, rather than over a weekend, for example. That would be right? So if we were to do this, essentially, we would have had to lay them before the Dáil really on Tuesday, yesterday, allow for yesterday and today, and then potentially have them come into effect tomorrow. Sometimes there's just a need to move. So what I'm genuinely trying to do is find a way of going as far as I can without removing the government's ability on occasion to move very, very quickly. Like, we're monitoring Omicron on a daily basis, you know, in terms of responses. So that's the rationale on. But I am trying to go as far as I can. Other than that, Deputy McGrath, look, of course you oppose this. You've opposed everything on COVID. Of course you want pre-legislative scrutiny, but what you didn't point out was that the officials did brief the committee, and I want to acknowledge and thank the committee for agreeing to waive pre-leg scrutiny as they have done before. But let's be honest, you've been against public health measures from day one. It is true. You've accused me, and here you go. You can't listen to it.
Point of order.
No, it's not a point.
I'm on record as saying, Count Cola, that's not true. It's simply an untruth. He knows that when you were in opposition with me, we attended meetings in government buildings, we supported all the measures from the start until the genie got out of the bottle, and we knew the kind of a fraud you were.
You see, Deputy, you're a great man for giving. You're a great man for giving insults. You're a great man for giving insults. You've accused me and the government of being Nazis. You said in here last week we should be brought to the Hague for war crimes. You're a great man for throwing out horrendous insults, but you can't take it. You can't listen to the response. Here you go again. You can't. You're not able to listen to the response. You just give it. You're not able to take it. You're not able to listen to any criticism.
Just correct the record. Right? I supported the measures at the outset for months.
You don't support the measures, and you have voted and advocated consistently in a way that would put people's lives at risk, that would put our nurses and our doctors at risk, and I think your record on this issue, on opposing all of the measures that are required to keep people safe in this country, speaks for itself. And what do? You accuse people of being Nazis and say they should be tried for war crimes. Right?
He continues to leave the House.
And you've continued to
be. He's factually not correct what he's saying.
And you're not able to take the criticism. You're able to lash it out, Deputy. You're able to lash it out. You say horrible things. You say horrible things to people in this House all the time. People elected to represent the people. You say horrible things to them all the time, but you're not able to take it. Yeah. To Deputy Smith, can I acknowledge the point, and I think Deputy Naughton made the same point. We do need a medium to long-term approach. I don't think it works for anybody to keep going through cycle after cycle after cycle. And I'd be very open to meeting with deputies to discuss it. Right. So we are thinking through more medium-term responses. You know, operationally, obviously, but also in terms of the Oireachtas, I'd be very open to any ideas. Obviously, the reason that we're in here again and again is because we've put in the sunset clauses. So it is one of the very important safeguards that is here. That's why we're here with going through the full legislative process now, is because we have the sunset clauses in place. So in one way, we're here for the very best of reasons, which is these powers fall automatically as they should. But I'd be very open to thoughts from any colleagues on how that could be, how else that could be done. And I think you had mentioned people who are unvaccinated as well. I think we might have addressed that. Deputy Naughton made reference to face masks being worn for children, and can this be constantly reviewed? It is reviewed a lot. Specific to these amendments and to this bill, however, face masks for children, the recent ones are advisory. They're not regulated for us. They wouldn't fall in scope. But I appreciate it is something we do need to keep under review all the time. Deputy Cullinan. Deputy, I want to acknowledge in a lot of ways over the last year and a half, you have been very constructive. And for example, you supported the mandatory hotel quarantining bill. But you've been firm in your criticism on this. So I'm going to be equally firm in my response. What I've been hearing is it feels very much like sloganeering, right? It's not that your concerns aren't legitimate. Of course they are. in terms of making sure that there's democratic accountability in place. But the things that you've said today are demonstrably false, right? You have said that we've never done any serious change to the legislation. We have. Change that you looked for, and I covered it earlier on. In fact, it's one of the reasons we're here, is because changes that you and your party looked for, which was a substantial change to these powers. I listened very carefully, went back to government, got a different decision, and came in and amended that, and that was the bill in June of this year. But I would note you still voted against the bill, from memory. So you asked for a very substantial change, you got a very substantial change, and from memory, and I'm happy to be corrected on this if I'm wrong, but from memory, your party still voted against the bill, just like my understanding is you're going to vote against the bill today. So we gave changes, we amended the bill as you wanted. You still voted against it. You say that there's no reciprocity, but there is reciprocity. And maybe you want more, and maybe we can do more. But to suggest that there is no reciprocity is simply not true. You're simply ignoring it. In terms of Oireachtas engagement, so a core part of the criticism coming from Sinn Féin is that there isn't sufficient Oireachtas engagement, that the Oireachtas is somehow being ignored. So I'm just going to very quickly go through this week and last week. We're not even finished this week. So the last week and a half, right? On Wednesday of last week, I had Shannon statements on COVID and COVID measures. On Thursday, we had the Dáil Health Amendment number 3 bill here. On Friday, we had the second stage of this bill. We had a private members bill, and you and I and many members here had oral questions. So all 3 of those sessions happened on Friday. Today, we had the health insurance bill, which is not relevant to COVID, obviously, but we've had that. And now we're here again for many, many hours. So that's just over the last engagement. Oireachtas briefings. Week before last there was one, and as I said, we're organising one for this week. And the officials did brief the Health Committee on this and on other bills. There is daily information being provided at a very comprehensive level in terms of vaccinations, hospitalisations, critical care and so forth. The NEFIT advice is published, the NEFIT minutes are published. All regulations are laid before this House, and either House can annul them, and all regulations are published online. And obviously, as per this session now, the legislation all falls because it has sunset clauses and the full legislative process comes into play. On top of that, Deputy, this week there have been 7, or between this week and last week, there have been 7 topicals on health in the Dáil. There have been 2 commencement matters in the Seanad, and this morning, of course, you, I and others spent the morning at the Health Committee discussing the termination of pregnancy review. In the last week, Deputy, there have been 499 parliamentary questions answered by me to this House through PQs. That was last week, and this week so far, by the time I got the note, 212 parliamentary questions had been answered this week by me to members of this House. So I would respectfully suggest that the allegation or the criticism that I am not engaging with this House and that there isn't a lot of engagement, that's just what's happened this week and last week. And I would suggest that that is a pretty comprehensive level of engagement. Now, to the core of the amendments, essentially what the... Do you want to come in, Deputy? Do you want me to stop for a moment? Right. To the core proposal in these amendments, right, it is that any regulation that government wanted to bring through would be laid before the House for a minimum of 48 hours. It would be reasonable to assume that they would be sitting days, right, that we wouldn't sort of do it on a Friday to come through on a Monday. And that the House would have to vote on every single regulation for it to come into effect. Right? That's the core of what is being proposed here in these amendments. Right? So if the Dáil is going to have to vote on every single regulation, I'm going to take it as a given that there would have to be debate before any such vote. Right? That's a reasonable assumption to make. And I'm going to conservatively suggest the standard debates we do here for everyone to go through the full group is 3.5-hour sessions. They tend to be what we do, right? So if we were to implement this approach, it would be reasonable to say that the government would lay these with a minimum of 48 hours before they could come into effect. And for the regulations to come into effect, there would reasonably be a Dáil debate where every deputy got the opportunity, called that a 3.5-hour debate, and then there would be a vote on each of the regulations. That's how this would be given meaningful effect. So I asked for a note on how that would play out in terms of the Dáil time taken. So since July, I've signed 171 COVID regulations. 171. I've signed 3 in the last 7 days since we were debating second stage of this, right? So a 3.5-hour debate on 171 COVID regulations is about 600 hours of debate. And if you assumed that we took 6 hours for every Tuesday, every Wednesday and every Thursday that the Dáil sits, which is most of the time given over to all of the legislation, that if we took all of that time, it would take 33 weeks of the Dáil sitting for us to do this, right? Now, since last July, the Dáil has sat for 52 weeks. So essentially bringing this in would take out 33 of the last 52 weeks the Dáil has sat. So since last July, the note I have is that the Dáil has sat for 52 weeks. Now, I don't believe, but over a year and a half, so since last July, sorry, of last year, Deputy, yeah, so 52 weeks, right? So at a very modest assumption that each of these regs has to be voted on, which is what the regulations say, a very modest assumption on one 3.5-hour debate, and that doesn't even get into the Shannon, that's just this House, that it would essentially take up all of the capacity that the Dáil has to legislate, because after you've got oral questions and order of business and leaders' questions and all of that, let's assume there's about 6 hours left in any given day. Essentially, these regulations, overnight, would end the Dáil's ability to legislate, more or less. 33 weeks, 6 hours a day, 3 days a week is what would be required, right? Now, that's not practical. It's not something that the Dáil could do. We wouldn't be able to do anything else, or we would be able to do very little other things, right? And so the question that I want to address is, given that that simply is not practicable, are there things we can do to address the very legitimate concerns that have been raised by colleagues today and last week and previously? And I hope colleagues will accept, you don't have to accept, but I hope colleagues will accept a very genuine effort in terms of briefings and notification on regulations and explanatory notes on regulations and the various other things that we have discussed. That is a genuine attempt to meet the spirit of what colleagues are asking for, because we simply cannot implement these regulations. So, Deputy, on a political point then, what I would say to you is, I have tried and am genuinely trying to meet the spirit of what is being asked for. You and I know that the regulations that you have tabled cannot be implemented. And so, if you're going to vote against this bill because we won't amend it in a way that would essentially end the Dáil's ability to legislate, then you are consciously and deliberately voting against a public health-led approach. And I don't believe that you believe that. I believe that you support the public health approach, and I believe that you and your party accept that there has to be a statutory basis for some of these regulations and some of these public health measures. And therefore, I would put it to you that it is simply not a reasonable position to say we support public health, we accept there has to be a statutory basis, but we are going to vote against that statutory basis unless you do something that cannot be done. I don't think that's fair on the people who we are trying to protect from COVID. I don't think it would be fair on the healthcare workers, on the doctors and the nurses and everyone else who's working in our hospital system. I don't believe that would be reasonable. So I would ask you to meet me halfway, because I'm genuinely trying to do things differently here. And maybe not withdraw your amendments, but don't vote against the bill. By all means, obviously vote for your amendments, but just think again about voting against the bill. Because the message that that sends to all of our healthcare workers and everyone who is going to get COVID and get very sick, and unfortunately a lot of people are still going to get it and they're going to get very sick, that sends entirely the wrong message. Thank you.